The United Nations Deputy Secretary General, Mrs. Amina Mohammed, arrives at the Federal Teaching Hospital, Gombe, where she is received by the Chief Medical Director, Dr. Yusuf Abdullahi, and his retinue of staff.
Human life is within sustainable development goals.
Mrs. Mohammed, who is back home for holidays, is visiting institutions critical to the realization of the Sustainable Development Goals.
Pride for me because I remember this place on the drawing board. That's where I started.
The Chief Medical Director of the Federal Teaching Hospital Gombe opens the tour by showing the UN Deputy Chief round the Institute of Health Sciences, which he founded to train health practitioners. This visit presents the august visitor an opportunity to encourage the students to give their best in order to strengthen health systems.
So this visit is about seeing it in its reality, listening to management on some of the issues they have. You need additional hostels, I understand. This in itself means that we have to take care of the people who take care of the people.
Describing Governor Inuwa Yahaya as a health systems man, Mrs. Mohammed also highlights the role of local governments in achieving healthcare goals.
I really want to congratulate the governor because His Excellency has always supported federal initiatives. This was a state hospital. It got to the stage of being a federal medical center, and we're very proud of it. I'm very proud that the management here of the center is thinking big, is thinking health systems, is thinking about reducing the health indices of the state, which around the nation are not good. This is about how government collaborates in a federal system. You cannot build a house from the roof down. It must be built from the foundations. Foundations are local government. We have neglected local government for many, many years. And now with this level of autonomy, there has to also be responsibility and there has to be collaboration. In the end, the local governments are in the states and the states are in the federation. So you cannot get away from each other and you have to work better together. So how we plan and how we spend the money, ultimately it must impact the lives of the people of Gombe. The women, the children, the men. As a society, we must be healthy. If we're not healthy, we have problems. And those problems will be translated into everything that we see around us.
The Chief Medical Director speaks on the UNDSG's visit.
See that she is here and she has seen what is being referred to as Renew Hope agenda in action of Mr. President Bola Ahmed Tinubu and also the activity of the Honorable Minister of Health, Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Patti. You can see the way we do, because one of the 4 points agenda of the ministry actually is to improve governance, which she has gone around, she has seen that really we are actually improving. The second also is to improve the bad indices in the healthcare, and she has seen that, and that one has to do with training and more training of manpower for health and everything. Her visit is very, very symbolic because they made decision at the higher level, and now she is here now to see it physically, to see it palpable, to see really what they are doing at the higher level. It is being translated down to the grassroots to actually reduce the maternal and child care.
While commending the Chief Medical Director for the visionary projects in the Federal Teaching Hospital Gombe, the UN Deputy Secretary General promises collaborative support in order to help transform the health systems and galvanize results.